Hi, everyone. Welcome to today's webinar. This is our second week of our legal and financial series. My name is Ariel Green, and I'm the caregiver support specialist at Care Partners. And we have Shalonda as well as Angela here with us today. Shalonda is with AARP. She's a volunteer. She's also an attorney, and she's going to do our introduction for today, as well as introduce Angela, just in case you weren't here last week. And so I'm going to turn it over to her. Thank you all again for joining us, and we're happy that you are here.
Yes, thank you, Ariel. And like she said, we are excited that everyone's here. For those that were here last week, I'm sure you enjoyed yourself and got some very helpful information. And so welcome back for those from last week. And for those that this is their first time, welcome. Like Ariel said, I am Shalonda Smith. I'm an attorney actually in Dallas area. And I also am an AARP volunteer. As you know, AARP is a nonprofit, nonpartisan organization with a membership for people 50 and older. There are nearly 38 million members nationally and 2.3 million in Texas, and about 400,000 AARP members living in Houston. So you can find more information about other upcoming events and volunteer opportunities at the AARP website at aarp.org/TX. So we're excited to have Angela Odinsky, our speaker today. Last week, she was awesome. She answered questions. She gave a lot of good, helpful information. So I'm sure you guys will be excited again this afternoon. She is a certified elder law attorney in Houston, Texas, who will be talking about essential estate planning documents today, or what?
No, today is aging in place.
Aging in place. Okay, great. So Angela is a native Texan. She received her BA from Southwestern University, Georgetown. Received her MA from Rayford University, Rayford, Virginia. JD from University of Houston Law Center, and CELA through the National Elder Law Foundation. Angela is licensed to practice in Texas and Washington. Angela's focus is estate planning, probate, elder law, and special needs planning. Angela is a regular speaker and presenter on topics of estate planning and elder law at Chevron, Baker, Ripley, Kelsey-Seybold, and a variety of caregiver groups. She's currently serving on the Unauthorized Practice of Law Committee of the Texas State Bar and is an active member of the Texas and Washington chapters of the National Academy of Elder Law Attorneys and the Texas Bar College. Let's all welcome Angela.
Hello, everybody. Thank you so much, Shalonda. Thank you, Ariel, for inviting me. I'm going to have to update that. It says Baker Ripley, and now it needs to be Care Partners. So I will get that done. And AARP, because now we're joining with all of these wonderful groups who are here to, we're all here to give information and to educate and to help people age better and help people age with dignity and with options and with choices. And so that is what we're going to be talking about today is what is your aging in place plan, right? What is your plan? What is your long-term care plan? I will go ahead and share my screen and we will get started with the presentation. I will ask that everybody hold questions until the end or kind of put them in the chat and we will get to them. I have an hour and a half to talk today. And so the presentation is going to take quite a bit of that, but then we can always talk about, have questions and answer sessions. All right, so what is your aging in place plan? Here we go. So planning is bringing the future into the present so you can do something about it now. When we don't plan for things, we have no control over what happens to us. We have no control over what our future looks like. We have to be in a reactionary state and we have to take the options that are available in that moment. And so I talk myself blue in the face to my clients, to my family, to everybody about what is your plan for aging. How do you intend how do you want your aging, what do you want your aging to look like? And how do you want to get there? So things we plan for vacations, we plan for dinner with friends, we plan for birthday parties, but nobody wants to think about planning for their future care needs, right? We all just want to go until we drop, right? Live, 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 and then die. Unfortunately, we don't do that. There's always this period of decline. And so how do we want to manage that period of decline? So the goal, as always, is to age with dignity, to access the best care possible, to take control over who's going to manage finances if you're unable to, and under what circumstances, who's going to manage your medical decisions, right? The goal is to make as many choices now while we have the ability to make those choices now, so that our aging looks like what we wanted it to look like, what we had in mind all along. Or even, what we just now started thinking about, because I'm about to start asking y'all a whole bunch of questions that you've never thought of before, and they're hard. They're not easy to answer. But it's important that we do answer them. It's important that we think about them in order to really be able to take control of our futures. Okay, so what is long-term care? When we talk about long-term care, that actually has a meaning. Generally speaking, it includes personal care needs known as activities of daily living. If you've ever had to deal with assisted living facilities or long-term care insurance, or if you're a caretaker, then you understand that there's ADLs. People call them ADLs, right? How many ADLs can you do? Activities of daily living. That's bathing, dressing, eating, moving from the bed to the couch, incontinence care, using the toilet, being able to take care of your day-to-day basic needs, right? Those are your activities of daily living. And that is a very, very important phrase to know and to understand what things constitute the activities of daily living. There are also things called instrumental activities of daily living, which is a little bit higher function. So that's your housework, shopping, caring for your pets, taking your medications, making sure that you take them on time and in the right order, prepping meals, cleaning up, managing your money, right? So sometimes, especially when we're dealing with long-term care insurance, they separate the idea of activities of daily living versus instrumental activities of daily living, and which ones are people able to do and which ones are they not able to do. So who is going to need care? Most of us. That's the short answer, right? Health and Human Services estimates that 70% of all people over the age of 65 will need some kind of long-term care. And people over the age of 70 have a much greater increased need for that long-term care. If we're just looking at Alzheimer's, and Alzheimer's is certainly the highest indicator or create, what's the word I'm looking for? Diagnosis that causes dementia. There are other kinds of dementias. There are other kinds of needs for long-term care, but just Alzheimer's by itself, in 2021, there were an estimated 400,000 Texans with Alzheimer's, and that's expected to increase 40% over the next 10 years. That's a lot of people that's going to need long-term care. Dementia is undoubtedly one of the highest needs for long-term care. And so we really need to find a cure, right? So we need to think about options. If you are caring for somebody, if you have concerns for yourself, if you have concerns for family members, then it's important to think about the future and what are our options going to look like. In order to know what options to look at, you have to know care needs. You have to have an understanding of what those care needs are going to be. People are living longer with more debilitating illnesses that don't actually kill us, right? So we're living a long period of time, but a substantial amount of that time is with some kind of debilitating condition that keeps us from being able to live our lives 100%. So we have to do the best that we can. And so we need to know what our care needs are so that we can maintain as much independence as possible for as long as possible. We need to know our financial picture, income, assets, everything. Bills, debts, the whole shebang. Like, you have to have a really good understanding of your finances in order to know what your long-term care options are going to look like. And you need to think about what you want. What are your wishes? How do you want to age? What kind of long-term care is most appealing to you? I know that there's this idea that we all just want to die happily in our beds in the house that we've lived in for 50 years. That's not possible for everybody. So what are the alternatives? What else do you want to do? Are you a social person? Do you like to be out in the community doing things? Maybe aging in place by yourself in your house, waiting for your kids to come visit you, is not the right place for you. Maybe in terms of what it means to age in place, your home is not the answer, but instead a community where you can have more social engagement, more social interaction. That's going to keep you independent and aware for longer. And so you need to know, what are your wishes? When you think about yourself in the future as you age, what does that look like to you? What is the best possible outcome? And then how do we get there, right? That's what planning for long-term care means. How do we get to that place that you want to be at? So options for long-term care. There is a world of options in between living in your own home and the old folks' home, right? That's what everyone kind of thinks. It's like, if I'm not living in my house, then I have to go to some horrible facility. It's not like that anymore. We don't live in that world anymore. We have so many options. There's, generally speaking, when we're talking about living at home, we have our unpaid caregivers, which is family members, right? People who just come and help us when they can. Paid caregivers, your companion care, your home health care agencies that'll come in. They work for about 4 hours a shift and can help you with laundry, can help you with some meal preparation, things of that nature, or they can even do some skilled care depending on what level of home health care you have. There are over 55 communities, retirement communities, that don't really offer anything in the way of care, but they do have increased kind of wellness checks, making sure that you're there. They might have some transportation to and from doctors. They might have transportation to grocery stores. They have outings, or more social, communal. Independent living facilities, the same as sort of the over 55 communities, except for maybe they have a little bit more in the way of assistance. They'll have more meals potentially available for you. It's a little less, it's a little independent living, your apartment, you get to do what you want, come and go as you want, but a little bit more help. Assisted living facilities, that's when you are not quite able to manage it on your own anymore, but you don't need a skilled nursing facility. You just need to know that there are people nearby that can come and assist you when needed. You can't really cook so much anymore. You don't want to cook so much anymore. All your meals are provided. Somebody can come in and help you with laundry, help you with bathing, help you with all of these sort of activities of daily living, right? We're going to go back to those activities of daily living. In assisted living facilities, you have assistance with those activities of daily living that you're not able to do for yourself. Personal care homes is another sort of, they're smaller houses with 4 or 5 bedrooms, 1 or 2 medical professionals that work there. Personal care homes in Texas can be a little bit tricky. You really need to check them out because if they have under a certain number of residents, then they don't have to be regulated by the state. And so you always want to make sure that if you're going to be in a personal care home, that you have vetted it thoroughly and that you understand what care is being offered. Memory care facilities are usually very nice facilities for people who have memory issues. They often offer therapies and activities for people who have memory loss. And then finally, our skilled nursing facilities. That's when you need skilled nursing 24/7. Someone needs to be there to help you, assist you in some way in a skilled function. The goal, when we say aging in place, when we say, figuring out your long-term care, it is to do as much as we can for as long as we can to avoid a skilled nursing facility. Honestly, we want to give you as much independence as possible for as long as possible. Generally, by the time you need a skilled nursing facility, that independence is down to 0. And so we want to we want to delay that for as long as possible. All right. So how much does care cost? Family caregivers, they might be unpaid, but they're not free, right? As any caregiver will tell you, this is not free labor. This is incredibly taxing and expensive labor in ways that's not necessarily just monetary. So it might be unpaid, but it is certainly not free. The median hourly rate for home health aides in Houston is about $24 an hour. I went and checked all these numbers yesterday, so this is the most current numbers we have. Assisted living for a year is about $50,000 on average in Houston, $140 daily. Skilled nursing for semi-private is about $63,000 a year, or $173 daily. And the median skilled nursing for a private room is $93,000 a year, or $255. Now, I have seen some facilities upwards of $350, $375 a day. I haven't seen a lot below 255, but they must exist because these are the median numbers, right? It is very, very difficult to privately pay for skilled nursing facilities. All right, so what are your payment options? How do we pay for these things? You can use your own savings, your own income. If you have long-term care insurance, or you've purchased long-term care insurance, or you have a hybrid policy long-term care insurance sort of bucket, that is, I highly recommend looking into that. Medicaid or VA benefits, if you have if you or your spouse served during a wartime era and you meet very specific criteria, then VA benefits might be available to you. You can implement a legal plan to protect your home and your savings, or you do a combination of all of the above. Generally, when you're talking to an elder law attorney, we're looking at a combination of all of the above. We want to tap every single resource available, everyone, and see what we can do to keep you as independent for as long as possible. So resources to consider. There is a senior services resource out there for every question you might have. If you don't know where to start, looking for a place, looking for a community so you're not living at home, but you want to live in independent living or assisted living, well, there are specialists who can assist you in locating those facilities. And it's more than just a place for mom, right? Which is just got a database, you call in, you tell them what you want, they give you a couple of names to go look at. I recommend working with individuals who know the communities, who go in and out of the communities all the time. They know the activities offered. They work with your family, they work with your loved one to figure out exactly what they want in their living community. Again, what are their wishes? How do they want to age? And they help you find the right community for you. There are companies who can assist with cleaning out and downsizing. I know for a lot of people, the reason that they won't leave their homes has nothing to do with what they know is right for them or what they know is best for them. It's the overwhelm. It's just being purely overwhelmed by, what do I do with my stuff? I don't even know where to start. I wouldn't even know how to start packing, much less determine what's going to go with me and what isn't going to go with me. There are companies, this is what they do. This is everything that they do. And they are magnificent. They take pictures of the rooms and they talk to you and they understand what it is in your home that makes it a home for you. And then they recreate that home environment in your new space, using the things that you loved, right? Or that you love and that make it a home for you. Those companies exist and they are worthwhile talking to them and helping figure it out, because not only will they help pack up everything and move into your new space, they will also help clear your house out and get it ready for whatever the next step for your house is going to be. Using your home to ease the financial burden. I don't always, reverse mortgages are not the solution for everybody, but they have their place. And it's worth looking at all possible options. When you're talking about what your long-term care looks like and how you want to age and what's the best way for you to age, that is an option that needs to be considered. It needs to be very carefully considered. Those contracts have to be read very, very carefully. You have to know exactly what you're getting into. But it is a resource to consider. Fall prevention courses. Nothing takes you from independence to no independence faster than a fall. Falls are preventable. You can learn how to be in your environment. You can do balancing exercises. You can go through evaluations and training to be more aware of what your fall risks are and how to moderate them, right? So talk to your doctor about fall prevention, because, and this is lived experience. We recently had to move my husband's 95-year-old grandmother out of her house because she fell and broke her wrist, and she's not ever going to be able to go back home. She went downhill almost immediately. And then this week, my mom fell and fractured a hip, right? And so now we're going through rehabilitation and figuring out what her next steps are going to be. Falls are preventable. You can go from living your life independently to not being able to live your life independently in one fall. So talk to your doctor, take fall prevention courses, get evaluated, find out what your risks are. I can't stress that enough. If you want to age in place, know what your fall risks are. Do some spousal pre-planning in your wills. Talk to your local elder law attorney and find out what you can do to protect as many assets as possible if you need government resources later on. And for everyone, the STAR Plus waiver interest list. We're going to talk about that for a second. So in Texas, Medicaid primarily pays for skilled nursing. However, we do have something called the STAR Plus waiver interest list. It is a waiver program through the federal government that allows us to waive our right to go to a nursing facility and instead accept those benefits under a home health care or even sometimes assisted living. You have to meet the same criteria as Medicaid for skilled nursing. It does pay for home health care, and it will pay for assisted living facility when the assisted living facility accepts the waiver program. Now in Houston, I believe there's only 2 assisted living facilities that accepts the waiver program. So you really have to be very careful about choosing the right spot for that if you're looking for the STAR Plus waiver to pay for assisted living. It is important to create a plan for eligibility before it's time to apply. But I highly recommend getting on the wait list now. I put the numbers up there. The 713 number is for Houston, Harris County. The 877 is if you're in another area of Texas. Get on the waiting list for the STAR Plus waiver, home-based community services. Right now in Harris County, the wait list is about a year or more. Different counties are going to differ based on the amount of people they have on the list and the amount of funding that we get from the state government. When you call, all you give is your name, your social security number, contact information, and that's it. You don't have to need it when you call to get on the interest list. As a matter of fact, if your name comes up and you don't need the care yet, you're not quite ready for home health care, you can just say, I'm not quite ready, but keep me on the list, right? And so then your name will come up again. So it's really important if you want to be able to age in place and you don't necessarily have the money for home health care, for the expensive home health care, that you get on the STAR Plus waiver interest list as soon as possible. Like I said, you don't have to know what it is. You don't have to have any condition right now. You don't have to be qualified when you get on the list. You just have to be qualified when you're ready for it. So creating a plan of eligibility prior to need is really important. All right. So what do we want to avoid? We want to avoid running out of money, leaving your home unprotected. When I say, I keep talking about leaving your home unprotected, a lot of, let me go back one. A lot of people avoid wanting to apply for Medicaid or needing Medicaid because they're afraid of the Medicaid state recovery program. Like everything else in Texas, the Medicaid state recovery program can be avoided with proper planning. Texas has some of the most lenient and beneficial laws when it comes to how we deal with Medicaid state recovery. And so if that is what's keeping you from putting your name on the STAR Plus waiver interest list, or from looking into Medicaid long-term care as a way to help pay for your long-term care in the future, then talk to an elder law attorney about Medicaid estate recovery and whether it's something that you need to be concerned about and what it is that you need to do to avoid it, because it is avoidable. We want to avoid risking the health of family and spousal caregivers. Family caregivers, especially spousal caregivers, are at far greater risk of serious health programs. I don't know why that says programs or death. I had some stats here about the significant increased risk of depression, reduced immune function, slower wound healing, hypertension, coronary heart disease. All of those things come with being a caregiver. And so we want to avoid that. So we want to make sure that as part of our long-term care planning, if our spouse and our family members are part of our long-term care planning, then we have to also recognize the risks we're putting on them. And we have to also plan for respite for them to make sure that they get the care that they need if they're going to be caregiving for you. Because it's stark what can happen to your caregivers. All right, considerations for aging in your home, things that you should be thinking about if you want to stay home. What's the condition of your home? Are there tripping hazards? Is it easy to navigate? Are your walkways too narrow? Are they the right size? Do you have those little plates and lips in between doorways that cause tripping hazards, right? What possible modifications might you be able to do to stay in your house and make it safer for you? What's your proximity to assistance, either in the community or to your family? Because if your name comes up on the STAR Plus waiver interest list and you need help and you qualify and you get, and Texas Health and Human Services says, yes, we'll pay for you to have home health care. If you live in an area where we can't find a provider for you, it doesn't matter. If you are like outside city limits somewhere and I can't get a provider to go out there to you, it doesn't matter that Texas Health and Human Services will pay for it. If no one's going to travel to where you are at, it doesn't do you any good. So one of the things to consider in terms of where you are and where you're aging is where are the resources that you're going to need as you age? And what's the availability of long-term care services near you? Do you have, are there community resources that allow for public transportation or meal delivery? Are those things available to you? If you want to age in your house, you have to recognize that at some point in time, you're probably not going to be driving anymore. And so are you going to be able to find transportation? Is that something that is going to be possible for you from your house? And all of these things kind of need to be thought through when you're in terms of long-term care. And so considerations for aging in a community. What's the access when you're looking at communities? What are the access to social activities? Do you care, right? Some people are not social people. They don't want to talk to anybody else. They want to just see the people that come see them, and they don't necessarily want to play bridge or mahjong. That's not their thing. Fine, right? But if you do want to be social, what are the social activities that are offered? What's the availability of wellness checks, right? So if you're going into a retirement community that doesn't have any care, what are the wellness checks? When is someone going to knock on your door if they haven't seen you in a while? What's the availability of transportation to doctors and stores? We get back to that transportation because it can be a real issue for people trying to age in place. Do they have transportation to doctors, to your doctors, to doctors nearby, to stores? And what kind of assistance do they offer with things like housekeeping and meal preparation? So if you're looking at moving into a community, what are the things that they offer for you? All right, so now we're going to do kind of a case story of planning, right? So Mary's story. A 78-year-old who recently lost her husband after a long battle with cancer. Family wanted to make sure that she's taken care of. She's got 2 kids who live out of state. So she's here by herself. What are we going to do? She owns a home worth approximately $300,000, and she has approximately $225,000 in checkings and savings. She receives Social Security of about $2,100 a month, and that's plenty to take care of her bills. Her house is paid off. There's no mortgage or anything. She has a long-term care policy she's been paying on for 20 years, and it provides a daily benefit of $150. So we have a lot going on here. She has an income that is going to be sufficient for her regular everyday needs, groceries, etc. She does have this long-term care policy. We're going to look at it real closely to make sure what it does cover and what it doesn't cover. And if it covers home health care, then we might be using that benefit to get some home health care in, right? So the plan is going to be to keep that long-term care policy. I don't know how many people ask me, should I keep paying for it? My answer is yes, keep paying for it. I know it feels like a lot. I sat down one time and did the math with a client. And for the past 20 years, they've been paying on this policy, and it was a Cadillac plan. They don't write these anymore. But it was one of those plans that had an unlimited daily benefit for an unlimited amount of time. There was no maximums. It was incredible. Like I said, they don't write those anymore. A bunch of long-term care insurance people went under after writing these kinds of policies. And he was like, I'm tired of paying on this. I understand that. I really do. I also understand that sometimes that there's an increase that goes, the premiums might go up. So we did the math, and over the 20 years he'd been paying, he paid about $80,000 for he and his wife. Okay, it's $93,000 for a skilled nursing for 1 year for one of them, right? So it seems like it's expensive in the moment, but when you need it, it is quite helpful. Now, again, this is one of the traditional policies where it was kind of like you pay or you lose it, right? Either you use it or you lose it. It's not like the hybrid policies, but it certainly was worth keeping just in case, because it would have been so much more expensive otherwise, and they can get home health care using it. They didn't have to go to a skilled nursing. It did pay for some home health care. I believe it also paid for some assisted living care. So, it's really important to look at those long-term care insurance policies that you do have, find out what the benefits are, and figure out exactly what's going to be the best for you moving forward. And keep it. If you have one, keep it. We might need to look at it and see what we can do about the premiums, but don't get rid of it altogether. And then, so Mary, sorry, I got distracted. Mary's aging in place plan. So she's going to keep her long-term care policy. She's going to place a portion of her liquid assets, that savings account, those CDs, into a family trust that her kids would oversee and get funds from if needed. She's going to keep some of her money to do home repairs or whatever else she needs. And then she's going to make sure she creates really, really robust powers of attorney for healthcare and financial decisions. We talked about those at length last week. If you were not here, your durable power of attorney is the most important document you can have while you're alive. And some of the powers that you find in a general one that you pull offline is not going to be sufficient for planning for long-term care. So if you want your loved ones to be able to plan for long-term care, talk to an elder law attorney about that power of attorney to make sure it has the right powers in it. Okay, so the results. So we did a little bit of planning for Mary, and if Mary's health should fail, she'd have access to the long-term care policy, right? She has access to her own funds, and her kids have access to the family trust funds if needed. After 5 years, because I know everybody knows about the 5-year look-back period for Medicaid, you can't give your stuff away. within 5 years and apply for Medicaid, or, there's rules. So after 5 years, all of the assets in the family trust would be protected and wouldn't be counted for Medicaid purposes if she needs skilled nursing care and if she needs to apply for Medicaid. And then if she becomes unable to make decisions for herself, the financial and healthcare powers of attorney or agents will be able to step in and make decisions for her. So she's got a plan in place. We know what's going to happen. Her kids are involved. We're ready to go. She knows we have something set. And if Mary and her husband had planned ahead, they would have had more opportunities, honestly. Typically, money received from a spouse is considered an asset of the Medicaid applicant unless it's received in a special kind of trust created by a will. So there are some estate planning things that you can do as spouses to create a situation where if one spouse passes, the other spouse can protect half of their assets and have them non-countable for purposes of applying for Medicaid. So there's all kinds of planning opportunities ahead of time that we can do when we're thinking about our long-term care. If Mary had done nothing, her home and all of her liquid assets could be consumed by long-term care costs. If she didn't have a good power of attorney, then she would be subject to a guardianship, which we talked about last week. I'm not a huge fan of guardianships. I'd much rather have somebody available there who can make the decisions that need to be made. There would be no funds extra set aside for her children to pay for things for her that Medicaid didn't necessarily cover that she needed more of for her care. And her choices would be limited, right? Nursing home might be the only option available to her. She may not have other additional options for her long-term care. So I think it's important to note, especially as we're about to enter the question and answer part of this presentation, that every client's situation is unique. That is a true statement. Everyone has a different picture of what they want their long-term care to look like. They have different resources to rely on. They have different people in their lives to rely on. They're all working on a different timeline and with a different level of urgency, potentially with a different level of capacity. There is no one-size-fits-all long-term care planning. So what worked for your neighbor's great uncle may not be what works for you or for your loved one. These are all very specific to the client circumstances. So when we start the question and answer, keep your questions broad because everyone is going to be unique and there's not going to be a whole lot of individual things that I'll be able to answer. So where to start, right? It's so overwhelming. Understand the scope of health issues for yourself, your loved ones who might need benefits. Know what their needs are going to be. Have an idea moving forward of what the picture looks like. What's the prognosis? If you don't know, and if the doctor can't really tell you, contact a geriatric care manager. They are professionals whose job it is to come in and help assess situations. They're usually nurses or social workers that can look at your the home environment, can see the tripping hazards, that can review your medical and kind of give an idea about, what to expect, how to expect it. Go to support groups for people with the same kind of dealing with the same kind of health conditions. Just know what to expect. Ask all the questions. No one knows until they get there what's happening or what's going to happen. And so it's really important to ask all the questions. Consider, if it's possible, consider home health care for the most difficult hours of the day. A lot of times people are most vulnerable when they first wake up in the morning, right? They needed a few minutes to kind of get stable and steady before they stand up. And so maybe have somebody come in to help with those morning hours. If somebody has more difficulty in the evenings, sundowning or other symptoms of their illness, then have somebody come in the evenings to help out with meal preparation and getting ready for bed. Consider alternatives to home ownership. Just because you're not in your house doesn't mean you're not aging in place, right? You can still age in a home, and it can still be your home. For some people, staying in their homes is the right choice. For some people, it is not. For a lot of people, they don't even consider what other alternatives are out there. And so they don't make a plan, and they wait for something to happen. And then all of a sudden, they have no choices anymore. All of those options are taken from them because they didn't have anything in mind, and they refuse to think about what the next steps would be outside of their homes. A lot of times, if we do a little bit of care, just a little bit, we can extend the time that you can maintain independence. And that is so important. Know your loved one's income and assets. I know that there's definitely a generation that didn't believe in talking about their finances with their kids. Well, at some point in time, we need to know. We have to know where everything is. We have to know how it's owned. We have to know where it's at. We have to know what is going to be in the best interest, how long things are going to last. I get panicked calls from people wanting to know how best to help their parents. And when they give me the details of their circumstances, I find that their parents have a generous income from both Social Security and pensions. There is significant assets, and they're living in assisted living with the help of long-term care insurance. And so sometimes it's just a math question. You sit down and do the math. What's the monthly expense minus the income? And then whatever that difference is, you divide the assets by that, and that's how many months you have, right? A lot of times this is just purely a math question. And so we have to decide, okay, well, when we do this math, it looks like your parents' assets are going to last 3 years. They're probably going to outlive that. So what can we do? Or it looks like your parents' assets are going to last them an additional 20 years. They're already in their 90s. I think they're probably fine, right? If the goal is for them to get care and for them to have the right kind of care, then they can cover it. Or they can't. And so what can we do? And so my first question is always, what's the math? What does it look like? How long do we have? And then we can kind of figure out from there what our options are going to be. And always contact an elder law attorney to discuss your needs, right? If it's simply just you want to avoid Medicaid estate recovery, contact an elder law attorney. We have ways to do that. If you're not sure where to go next or what to do, generally speaking, I have resources available that I can give to people who call. Sometimes I can't help everybody who calls, but I can say, hey, you need to contact these other agencies who can better assist you, right? So your local resources are always going to be helpful. Your local area agency on aging. So I put the web addresses. Let me go back one. So I put the web addresses here for you. So finding your local area agency on aging, they can help with things like meal prep, or not meal prep, but they can help with things like meals, transportation, depending on what your needs are, your income, your assets. They know where all the programs are. And so they can kind of help guide you through what programs are available in your community, your area agency on aging. The STAR Plus waiver interest list, I've already talked about it once. I'm going to talk about it again because I think it's really, really important if you want to age in place, that you get on the interest list and get on that wait list and find out when it's time that you have to get qualified. And there's also longtermcare.gov. One of the interesting things about that website is there is a tool where you can put in your age and it'll tell you, here's what you should be considering about long-term care right now. Here's where you're at. Here's the considerations. And here are links to other resources. That is a federal site, so it's not Texas specific, but it asks some really good questions, and it has some really good resources and will help walk you through, if you're just not sure, will help walk you through what long-term care questions and options are available. A lot of it is similar to what we talked about here, but if you just want to kind of look through it, that's a great website. All right, and that is my information. Angela Odinsky, my law office. I'm going to stop sharing my screen now, or rather I'll go ahead and go to the chat and see what we have. Yes, everyone should be able to receive the recording. If you prepare a legal plan to protect your home, et cetera, wouldn't you maybe be looking at Medicaid for care? Yes, Medicaid is the #1 provider of long-term care in the country. Most people are looking at Medicaid, even if they have long-term care insurance, they still have to supplement it at some point in time. But yeah, it is definitely a question that everyone needs to be asking themselves as to whether or not that's ultimately what they're going to be looking at. And then someone says many employers have stopped offering long-term care, and claims are being denied more because of costs. It's like any insurance, right? You have to know your policy. You have to be willing to make the phone calls. You have to be willing to go toe-to-toe with the insurance company sometimes. And oftentimes, especially if it's like an assisted living facility or home health care, your doctor, like you can get other people involved to help with your long-term care insurance claim. And like I said, there's now hybrid policies. You don't just have to do the traditional long-term care insurance. I know that there for a while, long-term care insurance, they sort of offered these incredible plans, like in the 90s and early 2000s, not expecting that people were going to continue paying and not expecting that people were going to actually use them. Turns out people did both. And so, yes, there were a lot of long-term care insurance companies that had some financial issues, but now they're trying to course correct. And part of that course correction are these hybrid policies. Some of them are riders on sort of life insurance, where you can get a long-term care rider, so you still have a death benefit, but you can also use the money for long-term care. There are different, I don't know all of the products. I know that there are a ton of these sort of hybrid financial products that allow you to generate assets, as well as use some of them for long-term care if you need them. So it's important to it's important to talk to a financial advisor, somebody who knows these products inside and out, about your situation, what your needs are, what your assets are, what your income is, and find out the best one for you. It's worth looking into. I say the two kindest things you can do for your family is plan and prepay for your funeral and plan for your long-term care. And long-term care insurance is often a part of that, at least. Okay. I have a somewhat long question here. So, mom is currently in a nursing home, and she manages the trust account because she's the power of attorney. So there's oftentimes when you're in a nursing facility, you might have a patient's trust account where a little bit of money goes into every month. She gets a monthly allowance of $60 for personal care needs. So the question is really going to be a policy for the nursing home, as far as like how often the $60 for the personal care needs can stay in the trust fund, as long as it doesn't get over the whatever the amount is that would disqualify. Because if we're talking about $60 personal care needs allowance, then we're on Medicaid. And though that $60 can stay, like I said, can stay in that trust account as long as it doesn't accumulate more than is allowable. So like, for example, if she also has a checking account somewhere with $1,000, you can't have more than $2,000 in assets. So that $60 doesn't need to accumulate. As far as when and how the nursing facility will allow you to withdraw, that's a policy of theirs. It's not necessarily, Medicaid doesn't care. They don't care if you take it out monthly or if you take it every 3 months or whatever, as long as you don't get more than $2,000. What's the cost of setting up a family trust? I knew I was going to get this question. I don't know. It depends, right? That's the normal lawyer answer. Like I said on the last presentation, I won't speak for other attorneys. I can only speak for myself, and I don't give numbers on these kinds of things just in one of these presentations, simply because there's too much that goes into what is going to be needed. It will depend on what kind of funding we're looking at. It will depend on who we're dealing with, how many different entities. There's a lot of questions that go into that. It's not simply a matter of just throwing a document up, right? There's a lot of specifics that have to be created. And so it can be costly, depending on what the circumstances are. It may not be that costly. It's certainly less costly than nursing facility. So it depends on what your goals are at the time. The list of links and phone numbers to contact the Area Agency on Aging. Let me go back one to the resources. So this is the overall Texas website, and you can go to your county and it will take you to your county's website for Area Agency on Aging. The STAR Plus waiver interest list, again, the 713 numbers for the Houston area, the 877 number is for just generally Texas, and longtermcare.gov. And you will have this available. I'm gonna, I'll send the slides to Ariel, and then Ariel can forward the slides on to y'all. All right, I'm going to stop my screen share now. And does anybody else have any other questions?
Thank you so much, Angela. I have a question.
Sure.
You spoke about the STAR Plus waiver program and how it helps to pay for in-home care. Does this Medicaid planning also apply to any of the other Medicaid programs like community and attendant services?
No.
Okay.
So community attendant services is not the same as the STAR Plus waiver program. That is a different program. You can still, yourtexasbenefits.com is a great resource. If you are not certain whether you are eligible for benefits of any kind, so there's so many different kinds of Medicaid benefits out there. If you are low income, low enough income, then there are benefits that help assist paying for your Medicare premiums, right? It's called the Qualified Medicare Benefit. If you are low enough income, there are programs that allow for or if you have needs, there are programs that allow for some home health care under very specific circumstances, which is the community attendant services. If you go to yourtexasbenefits.com, and I suppose I should have put that on the local resources slide, they have a pre-screening tool that says what you may or may not be eligible for. Now they're going to ask you about your income and asset circumstances. Whenever they ask you for income, they're looking for gross income, not net. So if you just give them the number of the amount that gets deposited into your bank account, that's not it, right? They want the gross amount. So they want the amount prior to having Medicare deducted from your Social Security, prior to having anything deducted from whatever money you're going in. So that's a good resource just to see if you qualify for anything. And that includes things like SNAP benefits, right? So food benefits, other, I think I said last time, there are oodles of Medicaid programs in Texas. All of them are going to have different requirements. All of them are going to be for different kinds of benefits. And so it's really worth, if you think that you might qualify, it's worth going into that pre-screening tool to see what you might qualify for. I think somebody had a question about Medicaid state recovery. Okay. Does this mean home ownership assets, et cetera, have to be preempted at least 5 years prior to Medicaid assistance is available? No. Medicaid estate recovery is required by the federal government to, if there's any funds left in an estate after somebody's been on Medicaid long-term care, I'm going to be very specific here, this is Medicaid long-term care, then the state can ask for reimbursement for funds spent on their behalf. Now, in Texas, we have a ton of exemptions to that. One of them is if you are married, then if there's a living spouse, then there's no Medicaid estate recovery. If your asset passes outside of probate, meaning that it's passed in a transfer on death deed or a ladybird deed, there is no Medicaid estate recovery, right? It is Medicaid estate recovery can only recover probate assets in Texas. That is the way our laws are written. That is not the same for any other state. So if you are watching from another state, your Medicaid estate recovery program is going to be completely different. In Texas, this is how ours runs. We value and honor family property. And so we do offer, there are ways to avoid Medicaid estate recovery. The 5-year issue that you're referring to is this idea of gifting. I hear this all the time. Oh, I can give up to $16,000 a year. Well, for taxes, sure, you can give up to $16,000 a year and not have to file a gift tax return. That has nothing to do with Medicaid. If you give $16,000 a year, that's a $16,000 gift, right? Medicaid looks, they want to know if you have given anything away in the last 5 years. And if you have, then that gift could potentially be penalized. Now, again, there are absolutely reasons why you may have gifted something that have nothing to do with Medicaid. And so we have to look at what those reasons are. This is so complicated and so complex. But we have to look back at that and see. So they do a look back and they want to know everything that was given away over the last 5 years. And they presume that whatever was given away for the purpose of qualifying for Medicaid. So if we have evidence to overcome that presumption, great, right? We can deal with that. If we don't, then there could be a penalty period. This is getting a little bit into the weeds about Medicaid, but it's actually a good segue for next week's, which is on crisis planning. which is basically when you are in the moment of needing skilled nursing care and Medicaid, what do you do, right? So one of the things that an elder law, if you go to an elder law attorney to help with qualification, to make sure that you have everything, all your ducks in a row, the first question we're going to ask is, what's those 5 years of bank records? I want to see that, because I want to see if there's anything questionable in there that we're going to need to address. And so that's what makes this so complex and complicated, is that there's a lot that we have to go through. But that's what that 5-year period is. It has to do with gifting rules for Medicaid purposes. Again, this is not about tax. There's no connection between what you can do with taxes versus what you can do with Medicaid. And there's also, family law is irrelevant. I don't care if you have a separate property agreement, community property agreement, whatever, it does not matter. Spouses' assets are all counted towards each other, period. Even if you have an agreement that says what's his is his and what's mine is mine, and we've never commingled and we don't own community property together, does not matter. Texas Health and Human Services looks at it as one big lump sum, right? Because they presume that your spouse is going to be taking care of you in some way. And so rules for other areas of law simply do not apply to Medicaid planning and to Medicaid qualification. Rules for Medicaid qualification apply to Medicaid qualification, period. All right, what other questions?
I think Eddie has a question.
I have a question. Angela, first of all, thank you for an excellent presentation and a very helpful one at that. If you have a situation where spouses are divorced but are interested in putting together a plan to benefit both of their children, is that possible? Should we just do that separately because of the legal relationship?
If they're divorced and they've already separated out all of their property, then yes, they should be doing that separately. Each one should have their own estate plan to benefit their children the way that they want to. Yeah, let's keep all that individual. If you've already divorced and separated everything out, let's keep it individual.
Thank you.
Anything else? I still have half an hour, but I went fast. I went faster than I was anticipating. I do have a full presentation on Medicaid estate recovery, which, you know, I'm also happy to do sometime in the future as well. But it's fairly simple. If you want to avoid Medicaid estate recovery, go talk to an elder law attorney in Texas and we can walk you through it.
Angela?
Yes.
I was just going to comment just on my personal experience. I had a grandma. She had 13 kids, but by the time she'd had dementia. So it's probably about 11, but it doesn't appear that anything was in place. And I actually attended a meeting with I think it was someone from the state regarding what they were going to do with my grandma, and put her in a home. And so it was all the siblings. It was nasty. So I would just, another, I guess, incentive or reason why it's so important to plan, because we think about, you just got to know your family, know the dynamics of who's going to be in charge and who usually is taking charge, and then the older ones fighting with the younger ones. So just whatever we can do to try to minimize as much as possible any kind of contention, because the thing about it ends up affecting my grandma. When the kids are fighting, when other relatives are fighting.
Oh, yes. Oh my gosh, yes. Inevitably, you have some kids who live here and you see grandma every day and they know exactly what's happening. And then you have the kids who live out of state and they come in and see grandma during holidays and they think everything's just fine. and they can't for the life of them figure out how come we're trying to sell the house. It is, family dynamics are 100% a part of this job. And managing those family dynamics, which is why you're absolutely correct. Choosing the people who are gonna be making those decisions is absolutely necessary. Choosing who's gonna be the point person and who is gonna be communicating with the rest of the family. And if that is still an issue, then there are people who devote their lives to mediation in elder law, right? They come in and they help families get to the same page because everybody wants what's best for grandma. What that is what's the issue, right? And so sometimes we need a third person to come in and say, okay, this is objectively what the facts are. And this is objectively where we're at. And, how do we get to a middle ground? How do we get to some place where everyone's kind of on board? And so there are elder law mediators out there who come in and work directly with the families to help them figure out what the best steps are. But yeah, family dynamics is everything. So somebody asked if I could devote some time to Medicaid qualifications and recovery because it's so overwhelming. Come back next week. Next week's presentation is on Medicaid qualifications. If you find yourself in a situation where you aren't sure what to do next, your loved one is in the hospital, they're going to rehab, and then we have to figure out what their next steps are. And we're looking at a skilled nursing facility and we need to apply for Medicaid. Then next week, we're going to talk all about that. We're going to talk about the specifics, the bright lines, what are the requirements, what are the qualification requirements, what does Medicare cover and what does it not? A lot of people think Medicare covers a lot more than it does when it comes to long-term care. Medicare does not cover long-term care. It'll cover short stints of rehabilitation. It will cover short stints sometimes of moderate therapies inside the home. But it is not your answer to long-term care. So we're going to talk about the differences. What are the differences between Medicare and Medicaid? And how do they work together? So that is next week's. So that's, same bat time, same bat channel. It'll be noon on Thursday. We'll be doing this again. And we will talk specifically about financial and non-financial qualifications for Medicaid long-term care. All right, my husband is in a memory care home. He may outlast his long-term care. I really want to keep my side of the long-term care policy. What might be my best option to pursue for his care if he outlives his policy? That is a very specific question. There's so much information that I don't have, that I cannot answer that question. I would be happy to talk to you, contact my office, contact the office of another elder law attorney, give them that question and see what options might be available. Contact your financial advisor as well, and see if they have any options available, because when you say I want to keep my side of the long-term care, that leads me to wonder, is it a joint that you could use yours for him? There's a bunch of questions in here that I have just reading this question. It's never so simple as just here's the right answer. When it comes to long-term care, there are no right answers. There's just the answer that does the best that we can do right now, and the best that we can plan for in the future. That's why planning is so important, is because the more you plan, the more options you have available. And it sounds like you did a great job. You had long-term care insurance. And that's wonderful. Unfortunately, it is possible to outlive your long-term care insurance. And so then what's the next step? Depending on the memory care facility, I don't know. You might be looking at going into a nursing facility that has memory care and applying for Medicaid instead. But without knowing more about your situation, I couldn't say for certain. Only just that is a possible option. It is confusing. It is overwhelming. And there's no one-stop shop for all the answers. That the longtermcare.gov is a good resource. Your Texas Benefits is it yourtexasbenefits.com is a good resource where you do the pre-screening tool. You can get a lot of information from that, but it's not everything. There's always going to be some questions left. But there are people who can answer those questions. You just have to know who to ask, where the resources are. Like I said, there's a senior service provider for every possible need. I know someone who comes into the house and cooks for seniors. I know someone who finds assisted living for seniors. I know someone who packs up their house and unpacks it and puts the pictures back on the walls in new places when they're downsizing. I know people who are specific to that they sell houses specifically with understanding like the family dynamics of dealing with seniors and knowing that the issues that might come up with title companies when you're dealing with seniors, right? So there is a provider for every issue that might come up. You just have to know the question to ask and the person to ask for that. And if there's no more questions, then I will give you your time back. And then everyone can have a lovely afternoon, but come see me again next week where we are going to be talking about the actual Medicaid qualifications and what that looks like.
Thank you so much, Angela. Thank you everyone for joining. We'll be sending out the presentation, the recording and the presentation via email. So please check your email. Thank you all so much. Y'all have a lovely day.
Thank you. You too.